My name is Dr. Catherine Caronia, and I am the Service Line Chairman for Pediatrics for Catholic Health. Today I'm going to speak to you about childhood emergencies, and really by age range, because at each age we have to understand that there may be outside environmental dangers for your child. Beginning with when the baby is born to 1 month of age, normally for most children, what we will see is that they may look like they have some jerky movements, quivering, trembling hands. They may be very easily startled. And as they grow, as they develop, by the end of the first month, their movements may become smoother. And a baby that is placed on his or her stomach may make some crawling movements with his or her legs, not really getting anywhere, and even push up with their arms and able to move their head from side to side. So there is some movement, some ability to wiggle. And anything certainly that you would have any concerns about as far as your baby and their movements certainly should be discussed with the general pediatrician, who's always available to work and speak with you. As far as the safety check, even at this age, babies can accidentally get injured. What we need to understand and what we need to be very understanding about or cognizant about is car seat safety. Each and every time that a baby is in the car, you must use a car seat. It has to be properly installed and a federally approved car seat, not one that perhaps has been handed down from someone that may have already been in an accident, but truly a newer car seat. When you bathe the baby, ensuring that the temperature of the water is heated to much less than 120 degrees. And this is, again, to prevent scalding or burning of your baby that may accidentally be done if the water temperature is not checked. When placing a baby on a changing table, while it looks like your newborn may not be able to move or may not be able to turn or wiggle, please never leave a baby unattended on any surface above the floor. You don't know when you may have a baby that does wiggle and is able to make a movement that would allow them to fall. The other is suffocation prevention and ensuring that items such as the small objects, plastic bags or wrappings in the crib, in the bassinet, Band-Aids. That is a large problem when put on the fingers of the babies that may find their mouths and suck on their fingers. The other is fire prevention and ensuring that all of the clothing that you place your baby in is flame retardant. Ensure that your home has smoke detectors and carbon monoxide detectors. Remove any necklaces and cords from around a baby's neck. Do not attach pacifiers, medallions to the crib or around the baby's body or on the baby with a cord. For example, do not leave necklaces around the neck of the baby. This can all lead to strangulation if it should get caught or if the baby's arm should get caught between the neck and within that cord. I hope that the information that I presented to you today helps you to keep your baby safe. For more information, please visit the Catholic Health website. Thank you.